So I'm sitting here today with Major Neil Franklin from Law Enforcement Against Prohibition, and he's joining us to add his insights from many years of both law enforcement experience and working in terms of harm reduction and figuring out drug policy. And we really thank you for coming out and joining us
My
today.
pleasure. Thanks for having me.
So tell me about your work on the issues of addiction treatment and drug policy. How did you first get involved?
Oh, wow. Interesting enough, my first glimpse into this problem of drug prohibition was through Baltimore's Mayor Kurt Schmoke. Back in the late 80s, going into the 90s, I started my law enforcement career in the late 1970s. And shortly thereafter, I worked undercover in the 1980s as a narc in the Washington, D.C. area. Did some casework up in the Baltimore area as well. That's where I grew up. And through some of the work from Mayor Schmoke back then, I got to see and hear how he was beginning to look at this whole issue of the drug war. Right? He was first our prosecutor, and I was working undercover the same time that Marcellus Ward was killed, making undercover drug buy in Baltimore City. He was a detective for the Baltimore Police Department. And Mayor Schmoke speaks to this all the time, as he was a prosecutor, and I remember that. And then a few years after that, Mayor Schmoke becomes a mayor from the prosecutor. He starts a needle exchange program. And I happened to be a lieutenant with the Maryland State Police at that time, and I was assigned to the board for his needle exchange program. I was a uniformed law enforcement member. That was written into the law, so I had to be on that board. Not me particularly, but a uniformed member from law enforcement. And that got me to then see things from a health perspective and what can happen if we start to change our policies. But it wasn't enough to move me in a different direction, because soon after that I became the commander of 7 drug task forces in the western part of the state for the Maryland State Police, and then 9 on the eastern part of the state. And it wasn't until I retired from the Maryland State Police in 2000 when a good friend of mine, Ed Totley, who was working undercover for the Maryland State Police, was killed working a drug deal very similar to that of Marcellus Ward. And that caused me to stop and pause for a moment and to reflect back on all the violence that I had witnessed during my Maryland State Police career. And at that point I began to realize that I think we're definitely headed in the wrong direction with this war on drugs, because the violence continues to increase. More drugs are coming into our communities. Addiction rates are soaring. More potent drugs available. Nothing was improving. Flawed policy. And it was in 2003, right after the Dawson family murder here in Baltimore. A drug dealer set their home on fire in East Baltimore. It was right after that I went online and happened to stumble across Law Enforcement Against Prohibition. You know, as we all are looking for support, right? And that's what I was doing, and I found this group of crime fighters who had already traveled the road that I was now traveling, and I signed on and became a speaker. Started speaking in 2008, became the director of the organization in 2010. I actually stepped away from law enforcement to manage this organization, which is an international organization of crime fighters who have been on the front lines of the war on drugs, and now we're trying to end the war on drugs, which is war on people.
And you know, during your presentation to the Harm Reduction Conference earlier, you emphasized this point of changing the mindset in law enforcement from being warriors to being guardians.
Right.
What do you see your role as the executive director of LEAP? How do you connect that role back to making that culture shift?
So I have a couple of roles. Number one, we are a speakers bureau. So basically we have 170 of our thousands of members. 170 have dedicated their time and energy to go out and speak and to educate on so many different levels. Number one, the grassroots level. So we go to community organizations, Rotarian organizations, community-based organizations. We speak at local colleges and universities, from Harvard to Baltimore Community College, you know. And we speak in Annapolis in front of our legislative bodies. We speak on Capitol Hill about the harms of our current war on drugs and how they affect the lives of people, and how we have given law enforcement this duty which shouldn't be theirs. it belongs to healthcare practitioners. We are attempting to solve a healthcare condition, a health-related condition with criminal justice solutions, and it doesn't work. We have been here once before with alcohol prohibition in the 1920s. It didn't work then. I don't know why we think it would work now. And so managing the organization to keep the Speakers Bureau going, but at the same time, we are trying to educate our brothers and sisters in blue regarding these failed policies, regarding the fact that we are charged with enforcing policies that we should not be. We should be protecting people from people hurting people. Instead, we're involved in legislating morality. Murder, rape, robbery, crimes against our children, that's where we should be. And we're making a lot of headway, and I think law enforcement leaders around our country now are starting to see that and come together to reduce crime and incarceration at the same time, and they're starting to take a really good look at these drug laws. So that's our second thing. We got to bring our brothers and sisters along too and get them thinking differently about this scenario.
And as you're thinking about that culture change and how really it's the statutes that, you know, first there was the reaction, then there were the statutes, and then there's the enforcement.
Right.
From your perspective, what needs to be done to address the problems of drug addiction, drug-related violence in the state, but also nationally? Like what needs to take place in order to address these problems?
Okay, so first of all, we got to this place not because of scientific data. All right? It's not a scientific approach. It's about hysteria. It's about social control. It's about some other things, but it's not about a scientific approach. So we're starting to look at the data. And if the data does not support the methods that we are currently engaged in, I think it's self-explanatory. Let's change the game. Let's do something different. But let's look at the data and respond to the data. Our incarceration rate, we're 5% of the world's population. We have 25% of the world's prisoners because of the war on drugs. Most of the people that we are arresting in the war on drugs are nonviolent drug offenders, people who are suffering from addiction, people who are, possessing drugs. There's no funding, not enough funding for on-demand treatment, but it's not just about on-demand treatment for addiction to heroin or cocaine or whatever else. It's about wraparound services for that person. It's about other health issues they may be dealing with. Many of the people who are suffering from addiction are also suffering from mental health problems as well. And it's, again, as we continue to collect the data and analyze the data, it's going to be clear that we need to move this from criminal justice to healthcare. And we see it, it's happening, it's occurring, we just have to keep the momentum going. And that's pretty much it. It's not rocket science, and just another point that I want to make again. When we moved into this place of prohibition, expecting results like reduced addiction rates, reduced violence, reduced overdose deaths, reduced usage rates among our young people, and these continue to go in the opposite direction. We need to realize that, as August Vollmer said, who was one of the early leaders of the International Association of Chiefs of Police back in the 1920s, as he said, when you drive this business into repression, when you prohibit it and drive it underground, drugs become more plentiful, okay, because they're more profitable. You're going to have more people selling them. They not only become more profitable, they become more dangerous because of quality control standards, the lack thereof. And those who are addicted then resort to crimes to fund their addictions. We've created a very, very bad scenario here. And at the end of the day, you have to ask the question. Drugs are here. They will always be here. Who do you want to manage them? Do we want organized crime, crews on our corners, cartels, or should we, the community, manage drugs within our neighborhoods? I think we'll do a much better job, absent the murders and the kidnappings and the corruption and everything else that goes along with the illicit drug trade.
Absolutely. although these aren't views without their controversy. And
Absolutely.
it's a deeply political and deeply controversial subject to even bring up harm reduction
Yeah.
in terms of changing laws and changing statutes. What would you say would be the first meaningful step that Maryland could take, since we have delegates Moorheim and Lamb here with us today at the conference? What do you think would be the first meaningful step we could take in the state to really begin addressing these issues?
I'm going to mention three things, and probably in the order in which I think they should go. The first one is what is referred to as Law Enforcement Assisted Diversion, okay, LEAD program, which is in Seattle and Santa Fe right now. It's when a police officer comes in contact with someone who is either possessing drugs or a low-level distribution to support their habits. Instead of arresting them, it's documented, okay, the interaction's documented. That documentation is held by the prosecutor's office, but that person is then immediately paired with a healthcare practitioner, okay, for wraparound services, obviously treatment, and other things that that person may need. And as long as they are in the program, they don't even receive an arrest record, which is crucial. That's the first thing, and there's much more to that, but that's a quick scenario. The second thing, we need to move to a place of safe consumption rooms. We've done this in Vancouver, in Canada. We're doing it in Switzerland. And we're removing those who are addicted from the street corners, from the shadows, from the alleys, into a place where they can administer and receive their drug under medical supervision. This does a number of things. Number one, it saves lives. In these safe consumption facilities, there's not been one overdose death that I'm familiar with. It just doesn't happen because if they have a reaction, their medical practitioner is there to deal with that. It has greatly reduced the transmission of HIV through intravenous drug use because they get clean syringes. Knowing that they're going to be able to receive what they need on a daily basis, they're not out committing crimes to fund their addiction at the street level, and again, in the shadows and in the alleys. And all of their other needs are tended to, health-related, job training, job placement, and that's where it needs to be. And then the third is what they've done in Portugal. Let's decriminalize drugs for possession. Portugal's done it for a 10-day personal supply, and they've had great results. Now, I know people are going to say, but we're not Portugal. The principle is the same no matter where you are. They've had a 71% reduction in overall new cases of HIV for intravenous drug users, a 52% reduction in overdose deaths in Portugal. That would be a huge number in this country. For middle and high school kids, between a 22 to 25% reduction in overall drug use. That's success, and that's where we need to go.
Major, thank you so much for coming and talking to us today.
Thanks for having me. Appreciate it.